Chairman, Madam Secretary, welcome. Nice to have you here, and I appreciate having able to discuss some of these issues with you previously, but I wanted to raise some concerns we've had about the Great Plains Area Indian Health Service. The reports coming out of there have been unacceptable. Unfortunately, there has been a failure to deliver on the promises to fix healthcare services in this area. Reports of IHS's failings were issued in 2010, 2011, 2013, and in 2014 I was informed that a contractor was in place to strengthen the link between external oversight and the development of effective patient care processes. Report after report uncovers the same issues, yet when it comes to fixing these issues, the administration seems to continuously fail. So I would like to know from you what the administration has done in the past few years to engage with tribes in the Great Plains area to make meaningful reforms to the system and to ensure that patients receive the quality care that they deserve. So if you could talk a little bit about that.
Yes, thank you, Senator. And I share your concerns in terms of the progress that has not been made that needs to be made. There have been a number of changes that we are taking right now in terms of trying to get a different result from where we are. I think it was important, though, that when CMS said that we didn't have safety and quality issues, that we acted upon that to protect the health and well-being of the folks. That still means they need access to quality care, and how do we get there? First, in the region itself, we actually, I think you know, have changed leadership in the region. In addition, we are supporting that by sending some of our Public Health Commission Corps officers who are part of quality, who work on quality issues, in to supplement the IHS folks on the ground. In addition, at the department itself, in terms of making sure that we're doing quality and management changes, because I think it's both about meeting the quality standards, but management and culture that we need to make some changes in. And we have hired a deputy, Dorothy Dupree, who has come from the field to work on the quality issues, and brought in Mary Smith as another deputy to work on the management issues. In addition, I think you saw in the hearing, which you were in, I specifically asked the acting deputy, and thanked this committee for her hearing, Dr. Mary Wakefield, to actually put together an interagency group within the Department of Health and Human Services that met yesterday to see and set specific goals of what we can achieve during our time.
Thank you, and we'll look forward to continuing to follow up on those issues. I wanted to change gears for just a moment and ask about, and this is kind of a more forward-looking, I hope, on how we can make reforms at the IHS. And I'd like to follow up on at least an issue that I've addressed with the officials at IHS. But late last year, I requested an update on when the administration would finalize a regulation that was initially published in December of 2014, which would expand Medicare-like rates for physician and non-hospital-based services under the Purchased and Referred Care Program. I understand from the budget proposal that this regulation is awaiting approval at OMB, and I'm encouraged by what we're hearing about the progress, and I'm interested in when you believe that this regulation will be posted. And additionally, would like to know how the administration plans to conduct its consultation with the 9 tribes in South Dakota.
So with regard to the specific regulation that you're speaking of, yes, it is at OMB under its review process, and that is generally a 90-day process. We will, the comments come back to us, and the question is how extensive those are in terms of the timing, but it is at a late stage of a regulatory process, and it is one that is a priority for us in terms of those that we have gotten to OMB. So we're hopeful that soon we will get it out. I think it's also related to the issue that I think you know, because your state and your governor have been an important part, as has Alaska, of changing the way we do some other payment issues that aren't a part of that regulation, but I think are important to the payment system of how we provide health care. So we are working both on the regulatory front, but we're also working on something that doesn't, I think you know, require the same process in terms of the payment, and I think you know we're changing some of the matching rates.
Right, and I appreciate the effort there, and would just encourage you to continue to push OMB and to be able to move forward with the finalization of that regulation. I've written you in the past too regarding one area of improvement, which is the electronic mechanisms used to exchange information in the processes and the claims and payment process, and in the Purchase and Referred Care Program. Claims are still being mailed back and forth. My understanding is the administration is considering a move to electronic claim payments and would be interested in an update if that's something that the administration believes is feasible.
With regard to the specifics of where that one is, I'd like to get back to you on it, but the overall concept, I think you know, with the emphasis in our delivery system reform, one of the anchors of the strategy there is electronic health benefits and data and information, and the ability to move that more quickly so we improve quality and we improve affordability. So it fits within that overall of all that we're trying to do. Where it specifically is at this moment, I'll need to get back.
Okay, we appreciate that. Thank you. My time's up. Thank you, Mr. Chairman.